Major Depressive Disorder, MDD. Major Depressive Disorder, MDD, often simply called depression, is a common but serious mental health condition. It goes beyond the usual feelings of sadness or having a bad day. People with MDD experience persistent feelings of deep sadness, hopelessness, and worthlessness that don't go away on their own. These feelings can last for weeks, months, or even years. Depression affects how a person thinks, feels, and handles daily activities, such as sleeping, eating, or working. It's not just a mental state, it can cause physical symptoms like fatigue, aches, and digestive problems. MDD is believed to result from a combination of genetic, biological, environmental, and psychological factors. It's important to understand that depression is a medical condition, not a sign of weakness or something that one can just snap out of. Treatment usually involves a combination of medication, like antidepressants, and psychotherapy, such as cognitive behavioral therapy, CBT. Early recognition and treatment are crucial for recovery, and many people with MDD can lead fulfilling lives with the right support. Generalized Anxiety Disorder, GAD. Generalized Anxiety Disorder, GAD, is characterized by excessive, uncontrollable worry about everyday things. People with GAD often expect the worst, even when there is little reason to anticipate such outcomes. This anxiety is more than the normal level of worry and can interfere with daily activities and relationships. Symptoms include restlessness, feeling on edge, difficulty concentrating, irritability, muscle tension, and sleep disturbances. GAD can develop gradually and can affect individuals of any age. The exact cause is unknown, but it likely involves a combination of genetic, environmental, and psychological factors. Chronic stress can also contribute to the development of GAD. Treatment typically includes psychotherapy, particularly cognitive behavioral therapy, CBT, which helps individuals understand and manage their anxiety. Medications such as antidepressants and anti-anxiety drugs can also be effective. Recognizing and addressing GAD early can significantly improve quality of life. Support from family and friends, along with professional help, can make a big difference for those struggling with this disorder.
Click subscribe to this channel to get more topics you love.
Bipolar Disorder. Bipolar disorder is a mental health condition marked by extreme mood swings that include emotional highs, mania or hypomania, and lows, depression. During manic episodes, individuals may feel euphoric, full of energy, or unusually irritable. They might engage in risky behaviors, have racing thoughts, and feel a decreased need for sleep. In depressive episodes, they experience symptoms similar to those of major depressive disorder, such as deep sadness, lack of energy, and loss of interest in activities they once enjoyed. There are different types of bipolar disorder, including bipolar A, bipolar II, and cyclothymic disorder, each with varying patterns of mood swings. The exact cause of bipolar disorder isn't known, but a combination of genetics, brain structure, and environmental factors play a role. Treatment often involves a combination of medications, such as mood stabilizers, antipsychotics, and antidepressants, along with psychotherapy. Managing bipolar disorder requires a long-term approach, including regular follow-ups with healthcare providers, medication adherence, and lifestyle adjustments. Education about the disorder and support from loved ones are also critical in helping individuals manage their symptoms and lead productive lives. Schizophrenia. Schizophrenia is a severe mental disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they have lost touch with reality, which can be distressing for them and for those around them. Common symptoms include hallucinations, seeing or hearing things that aren't there, delusions, false beliefs that are not based in reality, disorganized thinking, and abnormal motor behavior. Schizophrenia can also involve negative symptoms, such as reduced ability to function normally, lack of motivation, and withdrawal from social activities. The exact cause of schizophrenia is not known, but it is believed to involve a complex interplay of genetics, brain chemistry, and environmental factors. Treatment typically includes antipsychotic medications to manage symptoms and various forms of psychotherapy to support social skills and functional living. Living with schizophrenia often requires ongoing treatment and support. Early diagnosis and intervention can improve outcomes significantly. With proper treatment, many people with schizophrenia can lead meaningful and satisfying lives. Obsessive-Compulsive Disorder, OCD. Obsessive-Compulsive Disorder, OCD, is a chronic condition characterized by uncontrollable, recurring thoughts, obsessions, and behaviors, compulsions, that the person feels driven to repeat. Obsessions are persistent, unwanted thoughts, images, or urges that cause significant anxiety or distress. Compulsions are repetitive behaviors or mental acts that a person feels compelled to perform in response to an obsession or according to rigid rules. These behaviors are often aimed at preventing or reducing anxiety or preventing some dreaded event, but they are not realistically connected to what they are supposed to neutralize or prevent. For example, someone might obsess about contamination and repeatedly wash their hands until they are raw, or they might fear something bad will happen unless they count to a certain number repeatedly. These compulsive acts can consume a significant amount of time and interfere with daily functioning and relationships. The exact cause of OCD isn't fully understood, but it is believed to involve a combination of genetic, neurological, behavioral, cognitive, and environmental factors. Treatment typically includes cognitive behavioral therapy, CBT, particularly a form called exposure and response prevention, ERP, which helps individuals face their fears and reduce their compulsive behaviors. Medications such as selective serotonin reuptake inhibitors, SSRIs, can also be effective. Living with OCD can be challenging, but many individuals experience significant relief from symptoms with the right treatment and support. Understanding and patience from family and friends are crucial components in the management of OCD. Post-traumatic stress disorder, PTSD. Post-traumatic stress disorder, PTSD, is a mental health condition triggered by experiencing or witnessing a traumatic event, such as a natural disaster, serious accident, terrorist act, war/combat, rape, or other violent personal assaults. People with PTSD may experience intense, disturbing thoughts and feelings related to their experience long after the traumatic event has ended. They may relive the event through flashbacks or nightmares, feel sadness, fear, or anger, and may feel detached or estranged from other people. Common symptoms include intrusive memories, avoidance behaviors, negative changes in thinking and mood, and changes in physical and emotional reactions. PTSD can develop at any age and affects both men and women. The risk factors include experiencing intense or long-lasting trauma, having experienced other trauma earlier in life, having a job that increases your risk of being exposed to traumatic events, such as military personnel and first responders, and having other mental health problems, such as anxiety or depression. Effective treatments for PTSD include psychotherapy, particularly trauma-focused therapies like cognitive behavioral therapy, CBT, eye movement desensitization and reprocessing, EMDR, and medications such as antidepressants. These treatments can help individuals process their traumatic experiences and reduce the intensity of PTSD symptoms. Support from loved ones and understanding from the community are essential. Early intervention can greatly improve outcomes, helping individuals regain control over their lives and build resilience. Panic disorder. Panic disorder is characterized by recurrent, unexpected panic attacks. A panic attack is a sudden episode of intense fear that triggers severe physical reactions when there is no real danger or apparent cause. Panic attacks can be very frightening, and people experiencing them might feel like they are losing control, having a heart attack, or even dying. Symptoms include rapid heart rate, sweating, trembling, shortness of breath, chest pain, nausea, dizziness, and feelings of unreality or detachment. Panic disorder often begins in late adolescence or early adulthood, but it can affect people of all ages. The exact cause is not known, but it likely involves a combination of genetic, biological, psychological, and environmental factors. Stressful life events and certain changes in the brain's function may play a role. Treatment for panic disorder typically involves psychotherapy, particularly cognitive behavioral therapy, CBT, which helps individuals understand and manage their panic attacks. Medications such as antidepressants and anti-anxiety drugs can also be effective. Learning to recognize the signs of a panic attack and adopting coping strategies can help manage symptoms. With appropriate treatment and support, many people with panic disorder can lead healthy, fulfilling lives. Social anxiety disorder, social phobia. Social anxiety disorder, also known as social phobia, involves intense anxiety or fear of being judged, negatively evaluated, or rejected in a social or performance situation. People with this disorder may worry about acting in a way that will be embarrassing or humiliating. This fear can interfere significantly with daily activities, such as work, school, and personal relationships. Common symptoms include fear of situations where one might be judged, worry about embarrassing oneself, intense fear of interacting or talking with strangers, fear of physical symptoms that may cause embarrassment, such as blushing, sweating, or trembling, avoiding social situations, and enduring social situations with intense fear or anxiety. The exact cause of social anxiety disorder is unknown, but it may result from a combination of genetic and environmental factors. Negative experiences, such as childhood bullying or family conflict, can contribute to the development of this disorder. Treatment typically includes psychotherapy, particularly cognitive behavioral therapy, CBT, which helps individuals learn to manage their anxiety and improve their social skills. Medications such as antidepressants and anti-anxiety medications can also be effective. Support from family and friends, along with professional help, can make a significant difference in managing social anxiety disorder. With the right treatment, individuals can gain confidence and lead more socially active and fulfilling lives. Attention deficit/hyperactivity disorder, ADHD. Attention deficit/hyperactivity disorder, ADHD, is a neurodevelopmental disorder characterized by a persistent pattern of inattention and/or hyperactivity impulsivity that interferes with functioning or development. Symptoms of inattention include difficulty sustaining attention, making careless mistakes, not listening when spoken to, and being easily distracted. Symptoms of hyperactivity impulsivity include fidgeting, difficulty staying seated, running or climbing in inappropriate situations, interrupting others, and talking excessively. ADHD often begins in childhood and can continue into adulthood. The exact cause is not known, but it is believed to involve a combination of genetic, brain structure and function, and environmental factors. Treatment for ADHD typically involves a combination of medication, such as stimulants and non-stimulants, and behavioral therapies. These treatments can help improve attention, focus, and self-control. Support from family, teachers, and mental health professionals is crucial. With proper treatment and strategies, individuals with ADHD can manage their symptoms effectively and achieve their potential in various aspects of life. Autism Spectrum Disorder, ASD. Autism Spectrum Disorder, ASD, is a developmental disorder that affects communication and behavior. Symptoms generally appear in the first 2 years of life and can vary widely among individuals. Common signs include difficulties in communication and social interaction, restricted interests, and repetitive behaviors. Some individuals with ASD may also have sensory sensitivities, such as being overly sensitive to lights, sounds, or textures. The spectrum nature of autism means that it affects each person differently and to varying degrees, from highly skilled to severely challenged. The exact cause of ASD is not known, but research suggests a combination of genetic and environmental factors. There is no single known cause, and it is likely that multiple factors contribute to the development of the disorder. Early diagnosis and intervention are crucial. Treatment plans often involve behavioral therapy, speech and language therapy, occupational therapy, and educational support tailored to the individual's needs. These interventions can help improve communication skills, social interactions, and adaptive behaviors. Support from family, educators, and healthcare providers is essential for individuals with ASD. With the right support and strategies, many people with autism can lead fulfilling lives and make significant contributions to their communities. Borderline Personality Disorder, BPD. Borderline Personality Disorder, BPD, is a mental health condition characterized by intense and unstable emotions, relationships, and self-image. People with BPD may experience mood swings, feelings of emptiness, and difficulty managing anger. They often have a fear of abandonment and may go to great lengths to avoid real or imagined separation or rejection. This fear can lead to unstable relationships, where they might alternate between idealizing and devaluing others. Other symptoms include impulsive behaviors, such as spending sprees, unsafe sex, substance abuse, reckless driving, and binge eating. They may also engage in self-harming behaviors or have suicidal thoughts. The exact cause of BPD is not known, but it is likely a combination of genetic, environmental, and social factors. Traumatic life events, particularly during childhood, such as abuse or neglect, can increase the risk of developing BPD. Treatment for BPD often involves psychotherapy, such as dialectical behavior therapy, DBT, which focuses on teaching coping skills to manage emotions, improve relationships, and reduce self-destructive behaviors. Medications may also be used to treat co-occurring conditions like depression or anxiety. With appropriate treatment and support, individuals with BPD can improve their emotional regulation, build healthier relationships, and lead more stable and productive lives. Eating disorders, e.g., anorexia nervosa, bulimia nervosa. Eating disorders are serious conditions related to persistent eating behaviors that negatively impact health, emotions, and the ability to function in important areas of life. Common eating disorders include anorexia nervosa, bulimia nervosa, and binge eating disorder. Anorexia nervosa is characterized by an intense fear of gaining weight and a distorted body image, leading to severe restriction of food intake and excessive weight loss. Individuals with anorexia may see themselves as overweight even when they are dangerously underweight. Bulimia nervosa involves episodes of binge eating followed by compensatory behaviors such as vomiting, excessive use of laxatives, or excessive exercise to prevent weight gain. This cycle of binging and purging can cause severe physical and emotional damage. Binge eating disorder is characterized by recurrent episodes of eating large quantities of food, often quickly and to the point of discomfort, accompanied by feelings of loss of control and shame or guilt. The exact cause of eating disorders is unknown, but a combination of genetic, biological, psychological, and social factors is believed to contribute. Treatment typically involves a comprehensive approach that may include medical care, nutrition education, psychotherapy, and medications. Early intervention is crucial for recovery. Support from family and friends, along with professional help, can significantly improve outcomes for individuals with eating disorders.